Hey, if I had binoculars, I'd be using them right now, but I don't have any, so you're gonna have to go with me and pretend these are binoculars. I'm pretending I'm a Sentinel, because in this episode of the Recovery Room, we are talking about the Sentinel lymph node biopsy. Chances are, if you've had breast cancer or melanoma surgery, you've had one. So why did you have it? What does Sentinel mean? How is it different than a standard dissection? Why does it matter? And how does it help you? I'm cancer physical therapy specialist, Dr. Leslie Waltke. In this episode of The Recovery Room, we're talking the ins and the outs of the Sentinel lymph node biopsy. Lymph nodes are spectacular little structures that play multiple important roles in our health and safety. For more information on lymph nodes, please see our previous video titled, "What are lymph nodes and why are they so important?" posted on October 7th, 2018. If you are watching this video on YouTube, watch for the cards popping up towards the end of the video, either here or here or here. And click on that and that will take you directly to that video and others like it. Now, the reason your cancer team is interested in your lymph nodes is to see if there is any cancer cells in them. This helps them learn if the cancer may have spread beyond its original location, and if so, how much. Now, back in the day, everyone pretty much had the standard lymph node dissection. For patients with breast cancer, it is called the standard axillary dissection. When the region where a cancer is opened, individual lymph nodes are often not visible to the surgeon. So, during a standard axillary dissection, the surgeon will remove some tissue where they know lymph nodes are. It is actually the job of the pathologist to look through that tissue and count how many lymph nodes there are in that tissue and check out to see if any of them contain cancer cells. That is why if there are several people in a room that have had axillary dissections, most of them will have had a different number of lymph nodes removed from each other. On average, an axillary dissection will harvest between about 10 to 20 lymph nodes. Now, even though the average human axilla or underarm has 35 to 45 lymph nodes, the standard axillary dissection can lead to some significant side effects, including pain, cording, and lymphedema. So one of the drawbacks of this procedure is that it's a lot of surgery if it is unlikely to show any positive lymph nodes, like in the case of a very small primary tumor. And that is where the Sentinel lymph node biopsy has a very nice advantage. With a Sentinel lymph node biopsy, at the time of surgery, the area near the tumor will be injected with a radioactive isotope and a blue dye. These two things make the lymph nodes stick out to the surgeon when the area is opened. Now, because lymph nodes are typically found in chains, the dye and the isotope will highlight the first nodes in that chain. These nodes will be removed and immediately examined by the pathologist. Because these lymph nodes are first in the chain, they are given the name Sentinel. They are actually not anatomically at all different from any other lymph node, they just happen to be first. But if they are first in the chain and they are negative for cancer cells, there is no need to take out any additional lymph nodes because they too will be negative. By removing only about 1 to 3 lymph nodes with a Sentinel lymph node biopsy, as opposed to 10 to 20 with an axillary dissection, it does dramatically decrease the risk of developing lymphedema from about 20% to about 5%. However, what's important to note is that persons having a Sentinel lymph node biopsy may still have to contend with pain and cording. So it is recommended that all persons who've had lymph nodes removed see a physical therapist. I'm Dr. Leslie Waltke signing out from the Recovery Room. We will talk again soon.